everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk about whether gender dysphoria ever fully goes away. That is questions that a lot of people tend to ask, especially people who haven't started transition yet and are wondering whether transition would eliminate completely the presence of gender dysphoria. And I think it's a really important and valid question because statistically the research that we have on people going through transition and the outcomes of transition usually more tailored toward surgical transition, trying to really measure what is the positive outcomes of having surgery and whether surgery has helped individuals to live happier lives. And we know that that research all in fact documents that a higher rate of people who do go through gender surgery are living much happier lives. But whether gender dysphoria goes away, that is, at least right now, is not as studied aggressively as I wish it would be. So does gender dysphoria, in my opinion, and I'm just going to share my opinion, that's just my clinical opinion, that it ever fully go away? Well, it's hard to say because it really depends on individual cases and it depends on so many different factors. For example, I observed individuals who are much younger or have transitioned at a much younger age. They were very lucky, I would say, to be able to be acculturated and socialized in their preferred gender at an early age, and as a result that really helped tremendously to completely alleviate gender dysphoria. Now for some people who are much older and who transition later in life, I would say maybe about age 30 and up, sometimes gender dysphoria tends to continue even after you transition. What happens to gender dysphoria really is that it kind of takes on a different form. And what I mean by taking on a different form is that if in the beginning, prior to transition, a lot of your gender dysphoria clustered around not being out yet, not really living your life, not starting hormones, not doing any kind of medical or surgical intervention. Well, after your transitionary period is complete, whatever that is for you, whatever you decide to do in your transition, people usually hope that it's going to completely go away, but it tends to just take a little bit of a different turn because now you are living in your desired true gender. But as a result of living in your desired true gender, now what you stumble into is what I like to call social dysphoria. And what social dysphoria is when you're now experiencing different incidences of socially relating to other people, interacting with people, forming relationships, having interpersonal relationships, and intimate relationship. And because part of you, because you're older and you have been, in a way, what happens is that you have created a internal blueprint, internal roadmap of how to navigate those things socially out there in the world and how to navigate them in the genders that you were assigned at birth. And then when you transition, part of you unconsciously, kind of instinctually, tends to revert to the roadmap. So as a result, when you're out there and you're socializing and you're having personal relationships or experiences, a lot of times you don't even realize, but you revert to the behaviors and micro behaviors of the genders that you actually don't identify with. And the tension starts to arise sometimes because people pick up on that. Now, of course, people don't pick up on that to the point where they misgender you, but people pick up on that because they feel that there's something in terms of like social norms or social things is slightly a little bit off. And that's what I call social dysphoria. And that takes a while sometimes. It really takes a while for us to immerse ourselves in a social web of life and to start really having those experiences in relationship to our true gender. So that's one of the things that happens, is that gender dysphoria, although the initial gender dysphoria tends to go away, a lot of your, part of your mind that has been so preoccupied with it is freed up. You're able to concentrate more, you feel more freely, you feel much more like yourself. But then for some people, that social dysphoria tends to come in. There's also something else that tends to happen for some people, where gender dysphoria tends to go away, but as a result of gender dysphoria, body dysmorphia tends to come in. And that is when now you perhaps have had the surgical intervention you wanted to, but you're having body dysmorphia because now you are obsessively preoccupied that those body parts are not perfect. And as a result, that body dysmorphia is then further kind of pushes back on the gender issues you may still have that are unresolved, and subsequently causing gender dysphoria. So it's really kind of a complex system. I have seen in individuals where gender dysphoria has been completely eliminated. A lot of that depends, apart from being younger when you transition, it also depends on your overall worldview, your overall personality, your overall temperament, and how you tend to cope with things in life. People who are generally a little bit more optimistic, more positive, and much more adaptive are the ones who do much better, because they're much able to shift the ways they tend to look at things. And sometimes what's happening to them, they don't really categorize it in their head as gender dysphoria, whereas people who tend to be more pessimistic, less adaptive, less resourceful, when things happen to them out there, those individuals are very quick to kind of jump to that, oh, this is because of gender dysphoria. And a lot of that depends, again, very much depends on our adaptability. Now, remember when Darwin said that what did Darwin said, that about the species, that it is survival of the fittest, right? It's the fittest one who survive. Well, in reality, it's really not the fittest, but it's most adaptive people that tend to survive. And adaptability comes from life experiences. The more life experiences we have that are challenging and challenge us to grow, and the more we're able to reshape them and kind of grow out of those experiences, the more adaptable we become. And that also highly dependent on what is your supportive systems. The bigger your supportive systems, the more adaptable you're going to be. And unfortunately, a lot of times, some of the people are unable to have that. So again, dysphoria and this fact and idea of dysphoria, a lot of it is psychological, in a sense of we tend to kind of revert back to that, even though that the real presence of dysphoria is no longer present. We are living lives the way we see ourselves, and the world is not misgendering us, and the world does perceive us the way we perceive ourselves, but yet for some of us, dysphoria is still present. So keep in mind that it highly depends on a lot of factors, and there's no one way to really guarantee whether dysphoria is going to go away, but do keep in mind that it is highly also psychological. So the more resilient and adaptable you are, and that's also a skill in of itself, the better off you're going to be. So hopefully this is helpful. Comment below if you're somebody who especially have undergone transition, or any parts of transition that you felt were part of your transitionary past. Let me know, did you feel like your gender dysphoria completely went away? And for those individuals for whom gender dysphoria is still present even post-transition, comment below and share what kind of dysphoria you experience. Is it a social dysphoria? Is it dysphoria in relationship to your body? Or even interpersonal dysphoria, where we have struggles interacting with somebody else. So comment below. I'd love to hear your comments, and I'll see you guys all next time. Bye.